beforehand. How are you?
Yeah, I'm really well, thank you. It's absolutely sweltering in this office, so I'm hoping my makeup doesn't fall off my face whilst we do this.
You look amazing as always.
And you. And thanks so much for joining us on this gorgeous sunny evening to talk about something that, yeah, is interesting to us when we start to get to the summer months, isn't it? Because we've got to start stripping off. And
who doesn't want to talk about cellulite and fat reduction when we're all craving, obviously, a bikini and a swimming pool?
Exactly that. Yeah, exactly. So yeah, well, welcome. Let me introduce you to our audience. I think we've got lots of people watching already. So thank you so much for joining us for our live this evening. The live is all about fat busting, cellulite busting, with our brand new product called the Onda, and we're delighted to be joined by Tempus in Belgravia, which if you haven't seen it online, go have a look. It's absolutely beautiful. One of the most beautiful clinics I've been in, and you've not long since set up, have you? So we're joined by the lovely Dr. Vila and by Lenka, the clinical esthetician here at Tempus Belgravia. But you were literally, just getting started before lockdown hit, weren't you?
Yeah, we literally had our fabulous opening party that I'm sure you and some of our audience members will remember, on the 27th of February, actually. Yeah. And then, let's say a good, 2 to 3 weeks later, we shut down. So, but hey, we're slowly crawling out of this lockdown. We're seeing light at the end of the tunnel, so we're very optimistic and positive. It won't be at the pace we'd obviously hoped for, but I mean, we're obviously all resilient and very keen on, getting rid of cellulite and fat. That's what we're here to talk about. So yeah,
I've been privy to so many conversations with people who have, put on weight during lockdown. I think it's inevitable that we're perhaps moving around a little bit less, that have been obviously looking at themselves in videos quite a lot. So I think that, this is the sort of treatment which, when things do bounce back, it should come back in, really sort of in high demand, let's say. Yeah. And we want to just take the time now, obviously, to share with the audience why this treatment is recommended, what it does, how it works. So please get involved, get engaged, ask us any questions that you like as we go through. We'll try and answer as many as we can. But yeah, just learn a little bit more about the Onda and how you'll be using it within your clinic when things get back to normal. Hopefully, just around the corner.
Yeah, let's kick off. Let's do it. So it's actually a pretty exciting technology with a very high safety profile, I'd say, and also in times of obviously like COVID-19 times, I think it's a very safe technology as well, because there's no like plumes, or any skin particles that are being generated. So it works through a Coolwaves technology. So basically comparable. I mean, I always compare it. I always tell my patients it's actually a microwave technology, and how it works is the waves work at a certain frequency and they penetrate the skin and they heat up the fat, and the fat will then start sweating. It's a process we call blebbing, and that way it heats up to a temperature of 50 to 55 degrees. It will permanently destroy these fat cells, and actually we do know for a fact that once you've permanently destroyed fat cells, they're gone forever. And the safety profile I always compare to putting a mug, or I mean, you can't put glass in a microwave, can you? No, but only for a very short time. Oh yeah, but I'm crap at cooking. I've not gotten better at that during lockdown. But so a mug with water, put it in the microwave, right? The microwaves, put it in the microwave for half a minute. The microwaves will heat the water, but not the mug initially. Yeah, and that's what it's comparable to. It won't heat up the skin, but it will heat up these fat cells. And it's a treatment that doesn't take too long, right, to perform. Eventually, some of the heat will dissipate will disperse, so it will cause an additional heating of the skin, and that will cause skin tightening. Which is on the
and it's quite interesting what you say regarding, you know, the safety profile, because obviously you're a plastic surgeon, so you're used to doing procedures that are you know, more invasive, and it could be that at this time people are looking for something that, you know, I think people don't want to go into hospital, you know, really at the moment, do they? And so this is something that would work, a treatment that would work really well alongside liposuction if somebody were having that, or any kind of surgical weight loss. But it can also be extremely powerful in its own right for somebody that doesn't want to go down that route, can't it?
Exactly, absolutely.
And
So
so quick as well. So we're trying to limit our times when our clients are actually in the clinic. So it's quite a decent area that we can treat within 10 minutes. So about 15 by 15 centimeters. So most people will just, you know, have that in their sort of stomach area. It takes 10 minutes. I've never known anything that's so quick to treat fat or cellulite or skin tightening. So it is amazing. I mean, you can have as many as 6 treatments within one session. But majority of people would usually come for maybe 1, 2, or 3. So say stomach 1 and then the flanks. So 2 other areas. So we can do all of that within 30 minutes, which is incredible. So people come in before they go to work or during their lunch break. It's fantastic. Yeah. So we love it.
Yeah, and that's the thing, isn't it? You know, people will get a genuine result. I mean, I think that, you know, there's an awful lot of you know, fads in the weight loss market, really, isn't there, and in the fat reduction market. And I know that one of the reasons that you were quite cautious about investing in this kind of equipment was because of, you know, you wanted to make sure that you had something that actually got a genuine result for your patients. And so I remember sort of needing to sit down several times and go through, you know, the science and the clinical evidence and the evidence to you that it was actually going to destroy those fat cells. And now, pleased to say, I've seen the before and afters of your clinic manager. So now I don't need to justify anything for you, because her results have been amazing, haven't they, so far?
Yeah, exactly.
We have some photos on the iPad. I don't know if you'll be able to see them, but we will share a few with you. So that's the, don't know if you can see.
Yeah, maybe you should like go closer.
So there is a before and after, and I'd just like to point out the definition in her, hold on, in her waist. I can't actually, so just about there.
Yeah.
So there was not very much definition in her waist before, and now it's just amazing. So she can actually wear her dresses that she hasn't worn for quite some time.
Oh, that's good.
Yeah,
so are we back? Yeah, it's stopped.
Yes, you're back.
So she
I've had a bad signal all day, so.
Okay. She had about 3 treatments, but she was noticing an improvement after the first one, especially in the skin quality. So she felt that her skin is much firmer and tighter. And then obviously as time went on, she was noticing an improvement in fat reduction as well. So I think there is about 1 or 2 sizes difference in her clothes. So yeah, it's been pretty amazing. So we are waiting for other clients who've already had a couple of treatments, and obviously as we go along we take our before and after, so we will be sharing other photos with you very soon.
Yeah.
Yeah.
Well, I mean, this technology is new to the UK, but of course it's really well established in Europe. So there are hundreds and hundreds of fantastic before and afters. So if anyone would like to see those, then we're regularly posting them on our Instagram channel, and there are some available on our website as well. So you can go and have a look at those and just see how good the results are for yourselves. But so You mentioned cellulite there. Could you just explain for us a bit more about how it can help to treat cellulite?
So cellulite, we all obviously know, sadly. I think I still have to come across the first woman who's not got cellulite, right? Even the fittest top models, they've got cellulite, so it's, I mean, that's a given. So cellulites are obviously, bumps and dimples, right? And the bumps we know are obviously fat cells, but the dimples are fibrous bands, like collagenous bands. And so the Onda's got, I mean, it's a dual action. Obviously, the fat, we know what it does to the fat. We talked about that. So it causes the blibbing, so the sweating of the fat cells, and then the permanent removal of the fat cells. But then to the collagenous bands, it causes a disintegration of these collagenous bands. So it will like slim them down, make them less tight. So so you get less of that like in dimpling, the indented aspect of these fibrous bands pulling down, and then the fat blips, causing that annoying typical or like orange skin aspect. So that's actually the dual action. That's how I explain it to my patients. I don't know if you usually tell something
that's
else additionally.
Yeah, exactly. So we try to basically rebuild the collagen within the bones and break down the fat cells. So that's pretty much it. The results have been really good for cellulite reduction as well. So again, we usually recommend sort of 3-4 treatments. Some people need a few more. Again, they have been noticing improvements after the first or the second one. But what I would like to say is that sometimes, because your body has to remove those fat cells that we've essentially killed, it takes time. So it can take, anywhere between 3 to 6 months after the whole package of treatments to actually see the best results. And then, that results will last for a long time. So it's definitely worth it.
And also important, I think, to stress is the fact that we've obviously got different types, different degrees of cellulite. And just in order for us to manage patients' expectations, and Leica does that very well, if you're like a type 2 cellulite, you can like get people that
you can get one
to a type 1, a very mild cellulite type 1, we can get you down to a very smooth aspect. It's obviously down to, we're managing patients' expectations, and I think anything above a type 2 will need a course of like more sessions and a regular maintenance treatments, couple months after having completed the course. But that's obviously, as practitioners and doctors, we obviously have to honestly have that discussion with our patients, manage their expectations, and then thus far everyone's been happy, so let's hope that continues.
Well, I obviously I'm biased, but my results personally have been absolutely amazing.
I've heard you've been stuck in quarantine with a machine. How good can it get?
I am the luckiest girl in the world.
You might be the first girl with no cellulite.
Are you completely cellulite and fat free now?
I'm not joking, but I very, very nearly am. Very, very nearly. There's like one resistant little dimple, but I'm gonna get it.
You're working it non-stop.
Yeah. So, like Lenka, then the treatment itself. What should someone expect from the treatment? What can they expect as part of the process?
So they come in, and the first thing we do is assess the whole body and decide what is the best treatment for them. So we take photos and we measure different areas. So we can treat sort of 15 by 15 centimeters within one session. So we measure the treatment area with this little device here, and then we input our findings into the machine, so the machine actually calibrates itself for that particular treatment. So everyone actually has a different treatment plan. We then get the patient to lie comfortably on the bed and just put a little bit of oil just to get the sliding action into the treatment, and it takes anywhere between, I'd say, 9 to 11 minutes. I think that was the maximum time. It's really, really simple. The cooling system in the machine is fantastic, so very comfortable. People usually just, scroll through their Instagram or, do a bit of work. When I treat Bela, she just sends tons of emails out.
Yeah, I'm just like emailing, and I'm a complete baby, so I've got a very low pain threshold, and I sailed through it.
She actually loves the treatment herself.
I love it.
Yeah,
I think I got 2 cooling sessions.
Cool.
Yeah,
exactly.
The contact cooler works very well.
Yeah, it's really good. And then 10 minutes later, we just finish the treatment, we wipe off the gel, and off you go. Ready to go. So it's really simple. I'm very particular with taking our before and after photos as well, because obviously people want to see what the progress is. And then the treatments are usually sort of 3 to 4 weeks apart, ideally. So we schedule them in as soon as they leave. So yeah, it's really easy actually.
And what about side effects? Should people be aware of any side effects? Will they have any downtime after the treatment?
You feel a little bit of warmth during the treatment, and then maybe for a couple of hours after the treatment.
Yeah, I think it might also depend on the amount of fat. So personally, I've been working out a bit. I don't have a big amount of fat, so I was completely fine. I have to say, it was a bit warm straight after. Some redness, obviously, logical. Obviously, you're obviously moving the probe up and down. And then the heat in combination with that friction, so to say, it was a bit red, but that was it.
That's it. I mean, you go back to your daily life straight after the treatment, no problem at all. So
no compression garments, no bruising, no nothing like that.
Nothing like that. No pain.
We recommend to drink lots of water.
Lots of water after, just to flush all the toxins out. We also tell our clients not to put any moisturizers on the skin for about a week before the treatment, because water and Coolwaves, they don't really mix that well together. We can't treat over dense hair sort of areas as well, so we do have to shave those areas if anyone is wishing to have a treatment around those, but that's pretty much it. I don't think there is anything else that they need to kind of do to prepare themselves.
That's a good question as well. Like, what areas of the body, are you commonly requested to treat?
So most of the time is legs, bums, tummies, bra fats, lap handles. We've had a couple of arms as well. I mean, obviously people are asking us about the chins. But we are waiting for our brand new applicator.
Putting some pressure on Bailey.
You can pretty much treat anywhere where there is cellulite fat or wherever you need skin tightening, a part of the face and breast.
Chest area, yeah.
And I don't think you would treat lower legs. No one's really needed to do that yet. Inner part of the knees. Inner part of the knees, we have done a couple of treatments of those as well. They have been very successful as well.
Have you had some good results on the knees?
Yeah, really good.
Yeah.
And have you had anyone sort of question you about maybe like why it's different? Is the machine different to, for example, like radio frequency? Because things like cellulite and skin tightening, we often see those treated with radio frequency, don't we? But the Onda is a very different energy. Could you explain what the difference is between the two?
Yeah, like the Coolwaves obviously penetrate much deeper than the radio frequency technologies. So by penetrating deeper, you obviously target the fat logically. So whereas with radio frequency, you get you stay more superficially, so you get that skin tightening effect. And with Onda, it's a dual action, right? Obviously, depending on the setting as well. Yeah. Mainly focusing on the fat, the waves penetrate deeper, and because of their frequency, they also stop at the fat level, so that's why the safety profile is so high. It's not like it then goes through muscle or penetrates deeper because of the frequency. So
and it actually kills those fat cells as well. Whereas radio frequency, you know, it can stimulate collagen and elastin. But from my experience, I mean, I've used radio frequency for the past 13 years. Yeah, you can get results on skin tightening in certain areas, depending on what the damage is that you're dealing with. But radio frequency, I've just not really seen that much of a fat reduction. So here, I can comfortably say that you will notice an improvement in fat reduction. So,
whereas, with radio frequency, we say it's merely for skin tightening
as well.
Yeah.
Down to managing expectations yet again.
Yeah. So. And again, the time difference, it's just so quick, you know, like 8 to 9 minutes, like usually from again, my experience, any skin tightening would take me half an hour and upwards to treat a small area.
Yeah.
But for me as a practitioner, it's quite a long time. For the patient, it's, you know, it takes a little bit, it's just time consuming. So nowadays, everyone wants to come in, get the results, and, you know.
Yeah. And for me as a complete crybaby and like zero pain threshold, I mean, I've had other technologies as well. The radio frequency technology, Lenka vividly remembers. I wasn't checking my emails anymore after a while. I was pretending I was comfortable, but at the end I was a bit squeamish, not gonna lie.
But that was different technology.
Different technology.
Onda, completely fine.
Onda, I sailed through it. Yeah, completely pain-free.
And do you have a handpiece with you to show the chill tip, the cool tip on the end?
I mean, you have the machine right here, but our phone is a little bit small. So
Yeah.
so this is we actually have 2 handpieces. So this is the small one, which is more superficial. So it treats mainly skin tightening. It's sort of a mild kind of superficial cellulite, and this is the cooling sort of cooling contact cooler. So that goes down to about 5 degrees. So we just sort of hold it on the skin and just circle around. So really, really comfortable.
Yeah, that's nice. The cool.
Yeah.
The cooler.
Yeah, so it's nice to have. I'm similar to you, Lenka. I've worked with lots of different body shaping machines over the years, and it can be a bit frustrating when there is just one handpiece that you can't get onto the smaller areas of the body, because, you know, a lot of women do have quite sort of slender arms where a big bulky handpiece won't fit nicely, and so having that variety enables you to actually treat those arms quite effectively, doesn't it?
Yeah, exactly. So we've enjoyed using it.
Yeah.
And so you're taking virtual consultations, aren't you now? So you're...
Yeah, we're doing lots of them, and I kind of started enjoying them. They work quite well. You get to know people. I think obviously from the comfort of your own home, people are more relaxed, and I think through that virtual consultation, people can then decide whether or not they like you as a doctor or a practitioner, and then they can obviously eventually book in for a real life consultation. So yeah, let's hope we can obviously see each other in real life soon.
Yeah, exactly.
So if people want to, they can get in touch now via your website and book in for a consultation for Onda and sort out any lockdown troublesome areas.
Through the website, email, Instagram, they can always DM as well. And then we will obviously book in a virtual consultation, and you'll see most likely the lovely Lenka, who will then chat you through the entire process yet again. Also talk about all the safety measures that we've obviously implemented. But we've got a massive clinic. I dare to say it's a very big clinic, so we can absolutely adhere to the social distancing measures. So I think that's a reassurance for many.
Yeah, certainly. Fantastic. Well, thank you ever so much for joining us.
Thank you.
Thank you.
And shall we finish just by saying who you'd recommend to have an Onda treatment? Like what's the suitability of it? Who would you recommend from your customer base to have this?
I think anyone who struggles with little pockets of fat, cellulite, or who is after skin tightening, you obviously need to be over 18 to come to our clinic. And, you know, it's all about assessment as well. So I don't like to exclude anyone. You know, everyone's more than welcome to come in for us to have a look. You know, we have a look. Usually they see Dr. Villa for, you know, other sort of treatments, or they'll see me. So we kind of make plans together, and then we decide on the best treatment plan for every client. So individual basis, but anyone who needs to remove some fat, who wants to treat cellulite or skin tightening.
Yeah, exactly.
Well, we're going to follow this Instagram live with a few posts of some of the amazing results that the Onda can achieve. And thank you once again, Team Tempus, for joining us and sharing your experiences so far.
Amazing. Thank you so much.
Thank you.
Thanks.
Love to see you like soon.
Yeah, exactly.
Yeah.
Thank you.
Yeah, come and visit us.
I will, as soon as we can.
Yeah, exactly. Bye, Lily.
Have a lovely evening. Bye.
Bye. Bye.